Yeah, good evening, everyone. Thank you so much for joining us this evening. Today we are live with Juice Doctor, one of our favorite consultants that comes on the show every evening, every Thursday. He'll be answering quite a few questions today. So the question and answer session today is on heart attack, angina, as well as blocked arteries. So our goal today is to ask him as many questions as possible in terms of heart attack, angina, as well as blocked artery. Before I start, just wanted to tell you a couple of things that Gloriedo Nutrition does. We do the bioscan, essential oils, massage oils, sleep oils. We also have herbs and spices. We have our skincare range, our hair care range as well. We also do a detox program for people that would like to lose weight. We also have the food intolerance scan. We have our seminars and workshop, which we try to do in schools and also on the Thursday evening where we talk about different topics. We do meal plans. We also do ready meals. We do cooking classes as well as nutrition coaching for those people that would like to change their diet. We have a pain clinic every Saturday from 2:30 to 7 p.m. And also we do a scan for people that like to know what their body really requires in terms of food. So we do a food for wellness scan as well. Tonight we've got Juice Doctor with us and he will be answering all of our questions. Before I ask him the questions, I just wanted to just tell you his details if you would like to contact him. His email address is aaronlives@gmail.com. Instagram page is Vivo Nutrients and also MI Healthcare. His two Instagram handles. The website is MI Healthcare. If you would like to also watch any of his previous videos, you can find them in Vivo Nutrients on YouTube. And also, if you would like to book to speak to him, you can do so on 0207 175 0052. Just before I start, I just wanted to talk a little bit about the different things that we have that affects us as individuals with regards to chest pain. And some people have chest pain, and that is when you have a pressure in your chest, tightness, heaviness, burning, that also could be referred to as angina. Some people have what they call a sharp pain. Other people have burning pressure. This is obviously linked with gall disease. Some people have tearing or ripping of inside their system, and that also will give you chest pain as well. Some people have aching around their chest area or tightness and burning, and also burning, which obviously some people say, oh, I've got ulcer, and sometimes these things link to chest pain as well. There are different locations where, the chest pain could be resided. Sometimes it's in the neck and the jaw. The chest pain could be on the top chest. Chest pain could also be in lower arm or in left arm. It could be in the middle of your chest as well. Sometimes around your spine. Sometimes on your left shoulder or both arms as well. Different types of chest pain. You could have pneumonia that also linked to chest pain. Heartburns also linked to chest pain. Heart attack, angina, peptic ulcers are all linked to chest pain, as well as acid reflux for some people. So what exactly is heart attack? Heart attack is not only the cause of chest pain on the upper left side. Lung problems also, fibromyalgia may also cause you to have pain around your chest. So tonight, I'm just going to ask Juice Doctor a couple of questions with regards to chest pain, with regards to heart attack. Thank you, Juice Doctor, for joining us this evening. My first question to you is, what exactly is heart attack?
Okay, can anybody hear me?
Yeah.
Okay, great. Thank you once again for having me. It's really good that we're covering heart attack and stuff today, because it's a topic that's happening quite often. We're seeing a lot of people, a lot of clients especially, are having issues with their heart. A lot of their parents are experiencing, heart issues. and a lot of people are having, myocarditis and inflammation and other associated problems that are affecting the heart. So it's good that we're having this conversation today, and I hope when you get the recording, you will be able to share it and spread it among, your nearest and dearest, so they can all benefit from the information that we share today. Okay, so fire away with your questions. You said, what is a heart attack? Okay, well, a heart attack basically causes chest pain due to the heart muscle not getting enough blood supply. The heart is a muscle, like another muscle in the body. It requires blood to work effectively and pump blood efficiently around the body. The blood is supplied to the heart by vessels called coronary arteries. For various different reasons, these arteries sometimes can narrow or sometimes can block off completely. And when this happens, the heart muscle doesn't get enough blood supply to function properly. So therefore it becomes strained. This usually will end up in chest pain or cause you some level of chest discomfort. You may have pain or only when you exercise, but as the heart needs to work harder to pump the blood around the body, you may also get chest pain when your body is resting. So this is effectively when you have a heart attack, when those arteries become blocked and narrowed and there's not enough blood supply going to that muscle.
Thank you very much for answering that question. So what are the causes of heart attack, please?
There's quite a number of different factors that can, cause someone to have a heart attack. Some of the main risk factors will be things like diabetes. If you have, extended diabetes with your sugar levels not being controlled, that can lead to heart attack. Smoking, if you're smoking, that's going to have a very direct impact on your heart and the health of your heart by blocking those arteries with the deposits and the debris and the toxins that are released from the burning of the nicotine. Also, if your blood pressure is, remaining uncontrolled for a long period of time, that will place a significant burden upon the heart, which could also lead to or cause a heart attack. And having a family history of coronary artery disease, or having lots of members of your family who've had heart attacks. If you have that kind of history, or you have that kind of relationship with people from your household, it's quite often that if they have or adopt a certain lifestyle, you're going to adopt that similar lifestyle. So you may well end up having similar problems. And then high cholesterol as well. If you have high cholesterol that is not brought under control within a specific period of time, that could also lead to heart attack. And of course, certain ethnic groups are more higher at risk than others.
Thank you very much for answering that question. So does that mean that this is only for mainly Asians and Blacks, or it affects everyone, heart attack?
It affects everyone, but you'd find that the numbers are a little bit higher among sometimes the Afro-Caribbean community, mainly due to their diet and the fact that they have a very high fat related or high fat regime of food, because the way they cook the food or prepare the food, a lot of fried food, a lot of food that's deep fried. With the Caribbean community, they have a lot of fried chicken, fried dumplings, fried, fritters, foods that are fried. And these put an exorbitant amount of oil, hot oil at that, into the arteries, which then tend to lead to arterial plaque or atherosclerosis, where just like when you look at a plate, and when you finish having that plate of meat or fried food, you see that greasy film appear on the plate. So when that same process happens in your arteries, that greasy film starts to harden, and that's what leads to the arterial plaque or the atherosclerosis, which will then clog up those arteries and end up causing the restriction or reduction in the flow of blood to the heart. So the Afro-Caribbean community are quite heavily exposed to that particular problem, and that's why they have slightly higher numbers of heart disease and heart conditions amongst that community.
Thank you so much again for answering that question. So what are exactly the symptoms of a heart attack?
Symptoms can vary. Most people develop chest pain with a heart attack, but not everyone, because everybody's different. The pain is often described as sometimes tightness or pressure in the chest, like a weight. You may feel that weight on your chest. Different people, as I said, have different symptoms and different ways that the heart or the actual manifestation of that pain will flow. But it's also some of the main ones. You experience pain, you may experience some kind of tightness, you'll feel a level of heaviness on your chest. And effectively, once you know that you're feeling like maybe short of breath and immediate shortness of breath, these are all signs that you may be having a heart attack.
Thank you very much once again. What should I do if I think I'm having a heart attack?
If you think that you or someone around you is having a heart attack, you should definitely, get in touch with emergency services right away. as time is of the essence, the faster you get the relevant attention, the less damage the heart will sustain. Often when the ambulance arrives, they will immediately do a heart tracing, ECG. Depending on what this shows, they will take you to either the local hospital or the nearest cardiac specialist unit. So definitely try and take action and get hold of some emergency assistance as quickly as possible to prevent extensive damage being sustained by the heart.
So if I had a heart attack, for example, how would I be treated? Do you know how I would be treated?
It depends actually on the type of heart attack you're having. If you have a stem, like a severe heart attack, an ambulance will likely take you to a specific or specialist cardiac unit. At the cardiac unit, they will immediately perform a procedure called a PCI, which is a percutaneous coronary intervention. And during a PCI, a tube is normally put into the artery through your wrist or your groin and passed up to the heart. The cardiologist will then, they'll take pictures of the heart and look at the heart's arteries by injecting some dye in through your veins and taking x-rays. If they identify a blockage, they can open it up with stents. Now, stents are like special springs that can hold the artery open from the inside, and these are generally quite effective in freeing up any blockage and causing the blood that may be held up to then flow freely to the heart. If you're not having a serious heart attack, then you may go to your local hospital where they will initially treat you with blood thinning drugs, things like warfarin, etc. And you'll likely have an angiogram and a PCI during your hospital admission. But it doesn't need to, be straight away. If during your angiogram they find any blockages, they can actually treat these with stents as well to ensure adequate blood supply to your heart. I mean, sometimes they can't treat the artery blockages with stents. So in this time, the team will then discuss what options they have with you or what options are available to you. One option may be to have a coronary artery or bypass graft, which is like open heart surgery. This is where the surgeons will use bits of blood vessels taken from your leg or from the walls of your chest and do a bypass. And they'll actually bypass the blockages, ensuring that blood reaches the heart muscle to enable it to function and return to some level of normal operation.
Well, thank you so much once again. So what products can I take if I was having a heart attack?
Before you get discharged, I mean, the hospital will generally give you, several, new or different types of medications. You may need to take different types of medication to help keep the arteries open, or things like antiplatelet drugs. One particular one they use quite often is aspirin. This could be lifelong, or it'll be up to a year just to, to get your levels back to stable levels. If you have a stent inserted, it's really important that you continue to take those medications every day for the duration that they've been prescribed, just to make sure that you get your arteries back to a level where you can have a normal flow or a sustained flow of blood to the heart. You may also receive other medications to take some pressure off the heart and to assist with its healing. So these will help the heart recover and strengthen your heart. They may also recommend, some kind of rehab program. We always recommend that you take foods that are high in potassium that really help to relax and strengthen the muscle of the heart. Foods that are supportive of the heart or supportive of the blood, things like beetroot. We have a product that we recommend called the blood pressure blend, which really helps to bring down the blood pressure. It has things like hawthorn berry in there, it has things like crataegus. It has, different sort of plant-based supplements that really help to, strengthen the flow of blood and to relax the heart muscle so it's not functioning under stress. And these all help to, to aid recovery after you've had a heart attack. And it also can help to prevent the heart attack by ensuring that you don't allow the arteries to get blocked up to cause that kind of condition in the first place.
Thank you once again for answering that question. So how can I prevent another heart attack if I had one before?
There are certain things you can do to help prevent another heart attack. If you're a smoker, then definitely stopping smoking can dramatically reduce your risk of encountering a heart attack. Taking your medication as prescribed can also help, as can modifying your diet and your lifestyle to reduce your blood pressure and your cholesterol. So exercise is another great way to help prevent another heart attack. So there are quite a number of different things that you can do to make sure that your heart remains strong, because the more you exercise yourself is the more you actually strengthen your muscles, just like you strengthen the muscles of the body by giving them some level of resistance training. The same way when you put some exertion or place some exertion on your heart through a little bit of strenuous exercise, even if you do 30 minutes each day, which is recommended by the British Heart Foundation, that will suffice to give the heart the relevant amount of exercise it needs to perform its function to a reasonable standard on a regular day-to-day basis.
Thank you very much. And before we continue, I just wanted to share my screen just quickly. Thank you very much, Juice Doctor, again for answering some of our questions this evening. So is a heart attack, what are the signs that you need to look out for? Just going over the points that he said, shortness of breath for men, tingling in the arm, the back and the neck, shoulder, and also the jaw. For women, sometimes they feel nauseous or they feel like vomiting or they actually vomit. Some of them have severe weakness, extreme fatigue, heartburn, and also cold sweat. So some of the signs that women have if they're having a heart attack is that they have pain in their stomach, unusual fatigue, shortness of breath, also sweating, and chest pain or discomfort. So a heart attack can be caused by a blood clot formed after rupture of the plaque. The clot blocks off the blood supply to the heart, and also a stroke can suddenly cause problems as well around your heart where you have disruption in the blood supply to the brain. Some of the warning signs that you might have is that you have inability to sleep. So if you're having those problems, not being able to sleep, it might be a sign that you're having a heart attack. Chest pain, paleness of the skin, clammy skin as well, pain in your stomach, muscular pain, weakness, and aches are also signs that you might be having a heart attack. Also, pain that doesn't go away, after you've taken those medicines that help with ulcers or those medicines that help with acid reflux, that is also a sign that you might be having a heart attack as well. We've already talked about some of the warning signs. Juice Doctors kindly told us about our diet. We need to change our diet. Genetics, he told us about the fact that Asians, as well as people from the Caribbean or Black Africans, are usually susceptible to this condition. He's also reminded us to stop smoking. And also in terms of gender as well, men are 3 times more likely to develop a heart attack or heart disease than women. If you have diabetes, high blood pressure, that is also another way that you can have heart attack. There are 3 different things that happens around our chest. We could have heart attack, it could have cardiac arrest, and also stroke. They are all similar and they're all linked to each other. So in terms of heart attack, again, you'll get chest pain, you get body ache, shortness of breath. For cardiac arrest, you could get blackout, you could get chest pain, and also extreme palpitations. For stroke, you will have mental confusion, disrupted speech, inability to walk, or not being able to see properly. So now we're going to go into the next set of questions, and it's for blocked arteries. So that's the next set of questions I'm going to be asking the Juice Doctor. Thank you very much once again, Juice Doctor, for being with us tonight. First question is, what is a blocked artery?
Blocked artery is when your arteries are actually clogged up and they don't have the levels of flow, of free flow to provide blood to the heart. Blocked arteries are generally caused, again, by buildup of excessive fatty tissues or excessive oil from your food or from your diet.
Okay. So what are clogged arteries then? If blocked arteries and clogged arteries, are they the same or are they different?
A clogged artery is when an artery is blocked up with too many deposits or too many blood cells in there at the same time. And when that happens, your arteries' ability to carry blood to the heart becomes restricted. When you have a blocked artery, this could be sometimes due to a vessel that has maybe torn or maybe spilled, and that's going to now prevent oxygen or oxygen-rich blood cells going through to your heart, which again could lead to a heart attack or some kind of heart complications, which you may not be prepared for.
So what exactly then is the clogged arteries then? Does that link to plaque, or how does that build up?
It builds up again from your food. It builds up again from your diet, as we mentioned earlier. When you have a diet that's very rich in fried foods, or a diet that's rich in foods that are very, very heavily saturated with oil, these type of foods or these type of products or byproducts will then start to accumulate in the arteries, and it will lead to what we call atherosclerosis, which is like, arterial plaque. Just when we described that situation earlier, where you have a plate and the food on the plate is it's displaying that greasy film. That film, when it starts to form in your arteries, will then start to form your blocked arteries, or form the blockage in your arteries, which will then prevent the flow of blood to your heart.
Okay, thank you very much for answering that question. The next question is, how would I know if I have blocked arteries?
It's not always easy to tell. Sometimes you may feel some discomfort, or you may feel some pain in your chest. You may feel some restriction in your circulation. You may feel you have cold hands, or you have cold feet, or you may find you have excessive headaches. These are some of the ways of knowing that there may be something going on in your circulation or in your arteries. You wouldn't necessarily be able to diagnose it or self-diagnose to know that it is some kind of blockage, but these are some of the telltale signs that you have some level of clogging or blockage happening in your arteries.
Thank you very much. So if your patient has come with, or if you scan someone and they had blocked arteries, what would you do?
Well, the first thing we'd look at is, what are they eating? Because we want to try and prevent the arteries from getting further blockage. We would look at what their diet consists of, what sort of dietary choices they have, what sort of dietary choices they're making, what does their day-to-day food consist of, what's their level of fried food, what's their level of what's their level of how many times a day do they eat, how many times a day do they have meat, what's their level of meat intake, because meat is another food that causes a lot of problems for the arteries. So when they have too much meat, because it takes a long time to break down, and it deposits and releases a lot of fat, especially the way it's cooked, you're going to find that these things are going to lead to problems. So we want to identify what quantity or what amount of these foods do they have in their diet, so we can help them to remove those type of foods, or the foods that are causing the problems, so that when we start to look at how we're going to remove the blockage or help to clear the arteries using a series of detoxification, blood cleansing products, different kind of teas, we want to make sure that once you've cleansed the arteries, you're not going to go put back the foods or continue ingesting the foods that are causing the problems and causing the build-up in the first place. But the sort of foods that we'd use, or the sort of things we'd use things like vitamin C. We use foods like sorrel. I'm sure everybody knows about sorrel. Sorrel is very good because it's very rich in vitamin C. It really helps to provide a great high level of antioxidant activity, which is going to break down a lot of the free radicals that are contributing to that condition. We'd also use things like garlic, which is a natural antiseptic, which helps to break down a lot of the bacteria that's building up in the arteries as well. Then we'd use things like SOS, which has a lot of essential oils that really help to cleanse the blood. These essential oils are quite renowned for their cleaning capacity because of the compounds that they contain. So we use things like SOS, we use things like Ultra Detox, we use things like blood cleanser, and then we'll also use things like blood pressure, the blood pressure blend. The blood pressure blend, again, is a very good product because I said it has a lot of plants that have an affinity, a particular affinity for strengthening the heart and for opening up those arteries and clearing away a lot of that, that debris, a lot of that cholesterol that's built up in the arteries. So there are a number of different approaches that we use, but we generally tend to really be holistic in our approach by not just looking at the problem, but looking at the root cause so we can address things at the source.
Thank you very much. I'm just going to share my screen again while we try to get back onto what we're doing tonight. Okay, so what causes blocked arteries? The doctors already explained to us is they're usually caused by fatty acid blocked in your, which obviously results in you having plaque. Your blood vessel walls become very thick, and that obviously causes the blood flow to become narrower. We have actually seen a few patients or clients of ours that have had plaque in their arteries. Also, what do your arteries look like? This is what it looks like. The healthy one is on the one on the left, and partially blocked one is the one on the middle, and if it's fully blocked is the one on the far right. So the one on the left, which is a healthy one, your blood flow is good, it flows well, but the partially blocked one, it's becoming very narrow, and then that's when you find that you're having a lot of chest pains. You're always feeling a bit sick, not understanding what's going on in your body. But if your arteries is blocked, the plaque is already built up and the lining has become really thin. So what we do in those situations is that we give clients like blood cleanser tea. We also give them some products that will help to clean their arteries. We also recommend them eating the right foods to make it easy for them. So in terms of clogged arteries, if you have had that, or we've told you that you've had that, you need to take a lot of garlic. Grapes is good to take. Spinach is also good to take. Fish, olive oil is good to use, or you can take 1 spoon of olive oil, that will help. Kiwi is also very good as well. Cranberries are good to take if you have blocked arteries or clogged arteries. The warning signs of clogged arteries is that you might develop a stroke, or you might actually have a stroke when the plaque has become too much and has accumulated around your arteries for a long time. So which means that blood is not flowing to your brain. Also, you feel very tired and also dizzy, feeling lightheaded most times. That's also another telltale sign that you have clogged arteries. Also having shortness of breath. Again, remember what we said earlier, having a heart attack, one of the signs is shortness of breath. Clogged arteries, the same, shortness of breath as well. Having chest pain is also another sign that you might have a clogged arteries. Chest pain or angina are also as a result of reduced blood flow to your heart. Angina also can be felt as pressure, as numbness, tightness, as squeezing or burning of the chest. Lower back pain is also another sign that you might have clogged arteries. So again, if you do have any of these things, this was also a sign that you might have that. So sometimes people don't do a scan for them to realize that they have it. But if you have any of these signs that we've mentioned, it's also a very good sign that you might have clogged arteries. Also, erectile dysfunction from
Oh my God.
it's, some of the some of the remedies for clogged arteries we said already is that you could make a mixture of garlic cloves to a cup of milk. So you can put your garlic in milk, boil them and drink it. That will help to increase blood flow to your heart. Allow the drink to cool and drink it. You could also do a mixture of turmeric and honey with warm milk and drink. That will also help to reduce the clogged arteries or reduce the strength of that. Also, cayenne pepper and cup of hot water 2 times a day would also help as well if you do have clogged arteries. Best food that you can have is oranges. You can have red wine, not too much of it. Lentils is also good if you have problems with your heart or anything to do with that. Kale is also very good. Dark chocolate is good. Almonds, garlic we've talked about so many times tonight. Sardines are also very good, and pomegranates as well. So I'm going to put you back to the juice doctor, and he will be answering more questions regarding the clogged arteries. Thank you very much. Yes, sir. You ready for us?
Yeah, fire away.
Okay, all right. Next question we're going to be asking the juice doctor is angina. So what is angina? Yeah. I'm too young to have a heart disease, right? I'm 30, I'm 40. It does that mean that I'm too young, or is it only for older people to have heart disease?
It's a very good question. many men are.
Just doctor, we're waiting for your answer.
Can you hear me? Can you hear me? My internet's a bit unstable. Can you hear me? My internet's a bit unstable. I don't know what's happening. My internet's a bit unstable.
I'm not sure what's happening.
Can
We
you hear
can't
me?
hear you.
Can you hear me? I can see you, but I don't know if you can hear me. Can you hear me? Things seem to be a bit frozen.
We can't hear you.
Can you hear me now?
When he comes back, I'll ask him. Okay, cool. Yeah, the first question was, what is stable angina? Can't hear you. You're muted.
Okay, how about that? Can you hear me now?
Yep.
We just had a little bit of technical, well, a bit of a glitch with the internet. I don't know why it's disappeared like that. But you're asking me about the age of young people. I remember that's what I remember you asking before about the age of if people are too young. Is that right?
Yeah.
Well, basically, I know a lot of people have this conception that heart attacks are a thing that only happens to older people, or, people that are more advanced in age. But just as a matter of fact, heart disease is actually the most prevalent cause of death among men age 65 and over, which is quite a well-known fact, which leads to many younger men believing that they're actually immune to heart problems, which is actually not true. Heart disease remains the leading cause of death for all men. And as you see, a lot of footballers are falling down on the pitch. You find a lot of athletes are being the subject or the victims of heart attacks, and the ages are getting younger and younger. So heart attack is not just something that is only the demise of the elderly. It's something that's affecting a lot more younger people, and the age numbers are coming down to be affecting younger and younger people every day. There's two main types of angina that affect people. You have actually the stable type of angina and the unstable, which affects about 9 million people around the world. So it's quite a huge problem and a growing problem, and something that people don't normally think about until they actually find themselves in the midst of it, which is not a good place to be at any age.
So what is the difference between stable and unstable? So what is stable angina?
Well, stable angina is actually when your heart works harder due to exertion or mental or emotional stress. The pain that usually goes with that, it normally goes away, once you start to rest or your heart no longer needs, as much oxygen. That's stable angina. Unstable angina occurs unexpectedly. It's like you're not really prepared for it. It normally happens due to the arteries, the coronary arteries that have been narrowed by plaque, from the fatty buildups. When you have that kind of very high fried food diet, that high fat diet, this is when you start to develop unstable angina. This actually reduces the blood flow to the heart, and it also may come about when a clot partly or completely blocks your coronary artery for a short period of time, and the clot will either break up on its own or with medication. If the clot persists and is not removed or broken down or addressed by one means or another, a heart attack may quite likely occur. Also, inflammation, infection, and secondary causes can also lead to unstable angina. So it's quite a significant difference between the stable and unstable angina.
Thank you very much for answering those questions and telling us the difference. What should I do if I have angina?
Well, angina pain, it can come and go, and it is actually a sign that you have heart disease that can be treated. Your healthcare provider may give you, nitroglycerin to relieve the discomfort. It can come in a tablet, a spray form, a capsule, a skin patch, or an ointment form. But if you do experience chest pain, and should that pain last longer than 5 minutes or be accompanied by another heart attack, or other symptoms such as shortness of breath, weakness, nausea, or lightheadedness, then you definitely need to seek help immediately. Again, the other alternative is that, you change your way of life. You start to address your health risks that increase your chance of developing angina, things like not smoking, eating healthy meals, food that are low in fat, foods that are low in salt as well. I know a lot of people tend to use a lot of salt in their diet when they're seasoning their food. when you have a lot of things like Maggi, you know, aromat, all those high, you know, high content seasonings, they're all very heavily laden with salt because that's the main place where they get their flavor from. Although they may be giving you a variety of different flavors, the main flavoring agent is actually sodium, in particular monosodium glutamate, or MSG. So these things will also, you know, place a huge burden on your arteries, and it'll be very hard for your blood to expel these levels of salt. So these are the kind of foods you want to avoid. The things you want to include of is, like I said, things like more healthy foods, or things like, you know, the celery we mentioned earlier. Celery is actually a very good food as well, because it's very rich in potassium. So I know a lot of people maybe heard about the fad that everyone's, you know, following, which is the celery juice daily. Drinking celery juice on an empty stomach, you know, it has amazing benefits for your whole body, including your heart, and surrounding or supporting muscles. So avoid things like, you know, extreme temperatures, you know, strenuous activities, and learn to relax and manage your stress a little bit better.
Thank you so much once again for answering the questions. What other conditions might cause me to have chest pains?
Chest pain can be caused by a number of conditions, including, and no people may not realize this, but if you have a problem with your gut, with your gastrointestinal system, or any kind of disorder in that area, such as gallbladder disease, or if you have a peptic ulcer or a muscle spasm of the esophagus, even acid reflux, these could all contribute to you having chest pain. May also signal another serious heart or lung issue, such as a tear in the wall of the aorta or a blood clot in the lung. So there are quite a number of different things that can cause chest pain. So it's good that you've mentioned that as a question, so that people can think about what they're eating and the effect that their food actually has on their heart and their whole chest cavity.
So what are the symptoms of angina?
It usually feels like pressure, like tightness, or like a squeezing in your chest. This can feel painful or like a dull kind of ache that won't go away. You may also feel it in your shoulders, in your arms. You can feel it in your neck, in your jaw or your back, or even your stomach. Other symptoms would include things like feeling fatigued, feeling quite tired, a level of dizziness, sweating, feeling sick, feeling nauseous, and also shortness of breath.
Thank you again, once again, for telling us that. I think somebody has a question. I'm just going to ask that question. Apart from steroids, are there any prescribed medicine for high cholesterol or natural alternatives proven to be effective?
Well, we did mention earlier the importance of having a more balanced diet.
Different.
Say again?
You know, I'm just asking the question. Apart from steroids, are there any other things that we can take for high cholesterol?
Okay.
That's the Marcia's asking.
Okay. If you have high cholesterol is a sign that there's something going wrong in your arteries, in your cardiovascular system. If you imagine a street or a road, and it's full of ambulances, and the ambulances on the left side of the road and ambulances on the right side of the road, that means there's ambulances on both sides of the road. That means you can't get through as a result of these ambulances. Those ambulances being there, are they necessarily a bad thing? Of course not. They're there to attend to some type of medical emergency. That's how cholesterol is. Cholesterol is the first, like the body's first responders. They're the first agents that attend to any site or any scene where there's some level of physical or biochemical or biological emergency. So when you have cholesterol, let's not look at cholesterol necessarily as a bad thing. When you have a high level of cholesterol, that means you have a high level of paramedics in your blood trying to fix some problems that's been caused either by your diet, by your levels of stress, or just in general by your lifestyle. So if you have been prescribed with some sort of cholesterol medication, they may give you statins or some sort of steroids. The first thing you want to look at is not replacing those medicine with something else. You want to look at, how can I prevent my arteries or my body from having these emergencies that is going to require high levels of cholesterol? That's the approach we'd like you to have, as opposed to what's going to be the quick fix. Because the reason why medical professionals will sometimes prescribe statins, basically what they're saying to you is that if you can't control your diet, we're going to give you some medicine that's going to help you control that flow of blood for you. Because if you can't control your fat or your processed food-rich diet, which is going to cause a lot of cholesterol to build up in your arteries, then we're going to have to give you some form of blood thinners or something that's going to help your blood to bypass those ambulances or bypass that cholesterol so that your body can still carry on functioning as it should. So your job as the host is to look at, well, what am I doing with my diet, with my lifestyle, with my, my management of stress that's causing the cholesterol to rise, and then work, quite systematically to start reducing those things so you never have to have the problem with high cholesterol in the first place ever again. But in the meantime, in the interim, yes, you can use things like we mentioned SOS Advanced, which is a very powerful blood cleansing product that really helps to wash the blood. We have things like Blood Pressure Blend, which again is full of very, very, very rich plants that really help to support the flow of blood and help to really break down those blockages and that debris and those arterial fatty deposits that are building up in your arteries. Look at foods like beetroot. Beetroot's very high in nitric oxide, and these things help to really open the blood vessels, and they also help to support the production of healthy blood vessels, which again are going to help to remove and to break down those deposits that are building up in the arteries. Again, we said things like rosehip as well, foods like celery, as we mentioned earlier. Black seed oil is also another very good product to use because it's very rich in compounds, and that really help to support healthy flow of blood around the body. And then lastly, hemp seed oil, because hemp seed oil is very rich in all the omega-3, omega-6, omega-9, has a very, very, very good perfect balance of all those essential fatty acids that are also very helpful for the good flow and a healthy flow of blood around your body. So if you're looking for an alternative to the prescribed medication, you can use any one or any combination of those, along with things like garlic and other, very blood sensitive spices that can really, or herbs that can really help to support the flow of blood around your body. But definitely try and, look at the first thing, which is what are you doing in your diet or your lifestyle that's contributing to the cholesterol to raise in the first place, and also make sure you increase your levels of hydration, because hydration is key for moving things in and around the body.
Well, thank you so much for answering that question. If anyone else has any questions they would like the doctor to answer regarding what we're talking about, or anything else, you can put it on the chat now. And my next question to you, sir, is are angina symptoms the same for men and women?
Are they the same for men and women? That's a very good question. Both men and women can experience the same symptoms of angina. They both will have, the classic chest pain, the pain in the jaw, the pain in the neck, the pain in the back, the pain in the tummy. But in general, women are more likely than men to develop less, I should say, less common symptoms like feeling sick, sweaty, dizzy, or breathless. They're less likely to develop those symptoms. And also things like microvascular angina, which are spasms in the smallest coronary arteries. And these will kind of separate women from men because they have a higher threshold for stress in the body. If you look at how a woman manages pregnancy, a man couldn't probably last 2 months of a pregnancy. So that just goes to show the difference between men and women when it comes to tolerating stress. Again, these are things that contribute to the higher levels of statistics when it comes to heart disease. Men have a much more higher level of heart disease and heart attacks and heart-related conditions and problems than women. But the general symptoms are the same, but there are quite, wide disparities between some of the other symptoms that women won't necessarily get, but men will. So to answer your question, there definitely are some differences between symptoms for men and for women.
So what causes angina then, or what are the common triggers?
Well, the most common cause is coronary heart disease. This is actually when the arteries that supply your heart, the muscle with blood and oxygen, are narrowed. And they're generally narrowed by that fatty substance, as we mentioned earlier, called plaque. So you see this thing called plaque keeps coming up. It has a significant effect and impact on the flow of your arteries, the flow of your blood, and the flow of your body as a whole, because the heart is the center of your body responsible for pumping the blood and oxygen around, the whole body. So where you have that plaque built up from that food that you've ingested, it's going to have a lot of complications for a number of systems that rely on a good, effective flow of blood to the various parts of the body. When you have that plaque built up, it means there's a less flow of blood to your heart. to the heart muscle, and this can cause angina symptoms. And things that can trigger angina with things like when you have physical activity, this when you notice that your arteries are not as clear or as clean as you once thought they may have been. When you have things like emotional stress, this is another trigger to show the levels of plaque in your arteries. Cold weather will be another thing that will trigger your angina pain. And also when you eat a meal, certain foods will also have an impact on triggering angina. And the symptoms, usually they can stop after a few minutes, but it's still worth noting that these are things that can trigger your angina pain when you're trying to identify how you can prevent them from happening as much. Also, things like panic attacks or feeling anxious, they can also cause chest pain. And if you experience this, it isn't necessarily angina, because anxiety, isn't caused by a problem with your blood flow, whereas angina is, but it's still good to look at and be mindful of your levels of stress and how you're managing them.
Thank you very much for answering the question. So what are the risk factors for angina?
There are a number of risk factors that can increase your risk of coronary heart disease and angina. And these include things like stress, your levels of stress, the levels of stress that you're taking on a daily basis, the things you're watching in the news. I haven't watched the news for a long time. And it's just by chance that I turned on the radio today and I heard that, Liz Truss has resigned. I didn't even know she resigned. I just heard them talking about Boris Johnson coming back. I was like, Boris Johnson? Where did he come from? And again, these are things that I purposely and intentionally do to make sure that I'm mindful and conscious of what I'm feeding into my mind, what I'm feeding into my heart, what I'm feeding into my body, because these kind of things could have effects on your levels of anxiety and your levels of stress, on your levels of adrenal function. When you start to take in what's happening in the news and start becoming anxious about things that may not necessarily affect you, they may affect you depending where you are in your mental state. But just being mindful of what you're taking on a daily basis can also have a significant impact on your levels of stress, because sometimes it's self-induced. If you spend too much time watching the news, you don't really get much good news. There's a lot of bad news, a lot of negative news, and these things will tend to have a negative effect on your stress levels. Also, things like smoking, another massive risk factor for angina. If you have diabetes, your blood sugar is not brought under control. If you're suffering with obesity, if you have high cholesterol, and it's not brought under control as well. And, whether you're using steroids, as the lady mentioned earlier, or you're using other medication, drugs to try and control it, if you don't get that high cholesterol down to a manageable level, you're also going to put yourself at risk of angina. If you have high blood pressure, just the same as the others, if your blood pressure remains high, then you're also going to be at high risk. And also, if you have a family history of heart disease, which again we mentioned is not hereditary or it's not genetic, but again, if your family has a certain lifestyle, they watch the news all day, you may watch the news all day. If they eat certain fried foods all day, you may eat those fried foods all day. So the problems that they have, you're more likely to have those same problems simply because you lead the same type of lifestyle. Also, or lastly, should I say, older age people, especially men who are 45 and over. And for women, your risk factor really kicks in around 55 plus. So men is actually at a younger age, your risk factor for angina, but women really kicks in at around 55, 56 going on into the early 60s.
Thank you very much. I've got two more questions to ask you. Is angina hereditary? So, like for diabetes, they say it's in the blood. Is angina in the blood or something that my mom can pass on to me? Yeah.
The short answer is no. Angina is not an inherited condition. It won't be found in a genetic test. But if, for example, your grandparents or your parents or your siblings or children have angina, then you have what's called a strong family history of that particular condition. Having a family history doesn't mean it's highly likely that you would get it. It just means this can increase your chance of developing a heart condition that could cause angina as well. So what I would suggest is that you find out more about your family histories or the history of heart conditions in your family and how you can reduce the risk. And a big key factor to that particular situation is by you identifying the sort of lifestyles that your family lived, the sort of choices that they adopted when it came to their food and their diet, and their problems that are associated with that. And if you find that they had a particular type of food or penchant for a particular type of food group or type of foods, and you have that similar penchant or you have that similar affinity for those same type of foods, then it's highly likely that you may also be quite susceptible to the same conditions that your parents or your grandparents or your siblings or your aunties were. So just by you making that connection and making that change, you can then break that cycle and ensure that you don't end up having the same demise that they did.
Thank you very much. So can I cure angina then? I think somebody has also asked a question. 1 second, let's just check. Is angina a heart disease? Yes, it is a heart disease, but yeah, just doctor answer that question.
Yes, it is. It is a disease of the heart, and as we described the symptoms earlier, it tends to be triggered by a number of different factors. But one of the key things that you notice is having pain in your chest that maybe feel like some level of tightness, which could then lead to other related symptoms. And then in relation to your question was, can you cure your angina?
Yes.
Cure is a very interesting word as well. But let's just say your doctor will prescribe you medication that will help manage or improve your symptoms to help your heart to function better. I guess that's a good politically correct way to put it. We can't really say things like cure in these kind of terms. That word is only reserved for the medical community. But a change in lifestyle, a change in diet will definitely help prevent, more fatty deposits, called plaque or atherosclerosis from building up in your arteries. And these will also improve your symptoms of angina. So, trying out the lifestyle changes, as we mentioned earlier, and for the person I was asking again about the disease, we more want to focus on prevention more than, the actual cure or the disease itself, because sometimes people tend to get held up on the diagnosis. Yeah, the diagnosis is just a name for your collection of symptoms, which they would say generally based on those symptoms, you have this condition. That's great. Don't accept that. You've got to look at what are the precursors that created that situation or created that environment in your body that presented those symptoms. And once you start to work backwards, you'll then see that there's a set of things that you were doing or not doing that has created an environment that has left you in that demise. And that's what you want to focus on changing. So if you're a smoker and you have angina, just think of quitting smoking, because smoking can cause the arteries to become clogged up very quickly. And this can make angina symptoms worse. It's never too late to stop smoking. And we can actually support you to doing that. In fact, one of our clients, she did our first stage of our program, our step 1 lifestyle change program, which involves a lot of detoxification, hydrotherapy, dietary changes, lifestyle changes, cleansing your bowels, cleansing your colon. She called me today and said, you know what? I've stopped smoking. And she said, I don't even want to smoke anymore. She stopped drinking. I can't wait to see her tomorrow so we can hear her full testimony. But she's coming along tomorrow to do her review. But she's so excited about the results that she's experienced already in just 3 short weeks of being on our lifestyle change program. She's actually quit smoking. This is something that she never thought she'd be able to do. But just because we were able to support her with the lifestyle changes, with the dietary changes, with the detoxification, cleansing a lot of the nicotine out of her system, clearing out a lot of the parasites that were locking on or latching on to those particular substances and toxins that were coming into the body. These are the things that were feeding her cravings. So once we got rid of those parasites, we got rid of those pathogens that were supporting and really living off those toxins. And then we stopped her from, having the surrounding foods and sugars and salts and foods that were feeding that environment. She found, without even making any effort, she just lost that whole desire to smoke and lost that whole desire to ingest, take nicotine and other poisons into her body. So lifestyle change has a significant effect and impact on your chances or your risk factor for angina and other heart diseases. Also high blood pressure, controlling your high blood pressure, getting that under control, using your medication or making irrelevant lifestyle changes, coming and seeing, Princess Glory, booking an appointment with ourselves, making sure you're aware of what the things are that you're doing or the things that are in your body that are causing these problems or contributing to these problems so you can identify them and put the relevant measures and interventions in place. Reducing your levels of salt or reducing your levels of salt recipes, because a lot of foods contain salt, Maggi, what's the other one? Aromat. There's a lot of these seasonings. I don't want to start mentioning the names, but there's a lot of these seasonings that are very rich and high in salt. And these are things that you may be taking your blood pressure medication on one hand, but you're supporting and fueling your blood pressure on the other hand by the food that you're eating and the way that you're preparing the food. So there's lots of things that you can do once you have the information. You can be informed to make the right decisions. Reducing your diet or reducing saturated fats from your diet, swapping some of the fat saturated foods for maybe more healthy foods, swapping some fried food for maybe some green food or some vegetables or steamed food. There's so many different ways you can approach eating and still have the enjoyment element incorporated. Reducing your cholesterol level is another good way to reduce your chances of having angina or prevent it from developing. Also getting exercise, go to the gym. We always recommend people to get to a gym. Even if you're not going to go and do the exercise in the gym, we recommend you going to a gym or a leisure center that has a sauna, that has a steam room, because when you go to that steam, it helps to remove a lot of toxins out of your body just through sweating. So sweating is another great way to relieve toxins and to take a lot of the impurities out of the blood and out of the system as a whole, because the liver is always working over time to get those out. And this also puts a burden on your body's ability to produce energy. So sometimes you may feel particularly tired or fatigued. This is just because of the levels of stress or the levels of toxins that are placing a huge burden on your immune system and your body's natural detoxification systems, such as your liver, your kidneys, etc. Lastly, I'll say to control your stress levels by, doing some kind of meditation, reading the Bible, having a faith or developing a faith, having some level of, something that you go to as a means of taking it away from your constant connection with the stressful situations in your lives. Meditation is a great way to do that. I mean, some people use yoga. We don't always advocate for yoga, but there are different types of meditation or meditative practices or activities that you can do that will really help you to bring down your stress and to make you have a more restful sleep. So those are just some of the few things that we can suggest and recommend. If you want to do a full consultation, you have our details. We can give you so much more information, so much more guidance on how you can, manage your heart conditions, angina, arrhythmia, any of the other, myocarditis, heart-related diseases or conditions. There's so many ways that we can approach them and deal with them, especially if you want to stop smoking as well. There's so many things that we can do and programs that we have that can support you, should that be the route that you want to go down. So I hope we've provided some useful information and tips that you can use and adopt and apply them in a practical way that brings you the desired results. So thank you once again, Princess Blue. And if you have any other questions, I'm more than happy to oblige.
I think somebody put a question there saying, as Africans, we don't have much fried food. Nevertheless, it's our elimination. Can that have an impact on us or will lead to us having angina, basically?
Yes, if you have a lot of fried food and you have it in excess, I mean, everything is admissible in moderation. As long as you balance it out with, having a good level of hydration, having a good level of exercise as well. If you make sure you incorporate a good level of fruits and vegetables, which will provide you the right levels of fiber, which will then allow those foods and toxins that you may have accumulated in your system from the fried food to be able to be removed through your digestive system and to be evacuated through the proper channels. If, however, you're not incorporating all those other elements and you're just having the fried food, it's then going to start to accumulate in your system, which will invariably lead to further problems. And yes, it can highly place you at risk of developing angina. So yes, there is a clear relationship between your food and your conditions or your heart health. So the more you start to become aware and start looking at what you're eating, how you're preparing it, what levels of oil, what levels of fat are in your diet, is the closer you come to removing yourself from that, that slippery road that may lead to heart disease or angina.
Thank you so much, Just Doctor, for coming and joining us tonight. And for everyone that joined us this evening, we want to say thank you so much. And for those that asked questions, thank you once again. And for the people that are regulars that join us every Thursday, thank you so much for joining us. We'll be here again next Thursday at the same time, 8 o'clock. Hopefully, Just Doctor will be with us next week to talk about any topics. If there's any topic we haven't covered that you would like us to cover, please text us and we would obviously try our best to cover those topics. And if there's any questions you'd like to ask us as well, feel free to text or WhatsApp message or on Telegram as well. Thank you so much once again, everyone, and we'll see you next week, Thursday, same time. If anyone else has any questions, they can ask, but the program is now finished.